how much exercise do we need to do every week? So this question is really, how much exercise do we need to do to gain some sort of health benefit? And these health benefits are many and very significant. And we're going to go over these next few videos into some more detail about what these different benefits are. But to list some of the big ones that you should know right off the bat, and these will include lower risk of mortality, which means death. There's lower risk of heart attacks and strokes. There's lower risk of diabetes, lower risk of several types of cancers, better sleep, better cognition, meaning how smart we are, reduced risk of dementia. So there are so many different things that will affect our lives through being physically active and doing exercise. So it's critically important to answer the question, how much exercise do we need to do to gain these benefits? I know it sounds too good to be true, but all of these benefits I listed have been backed up by strong scientific evidence. Many good research studies have been done that provide the evidence for this. And what they have done is they've culminated all this data from all these different studies to figure out how much exercise we need to do to gain the benefit. Hey friends, welcome back to our channel. If you're new here, I'm Dr. Edmond Cleeman. I'm an orthopedic surgeon here in New York City. On this channel, we explore physical activity and exercise, how it improves our health, and some of the strategies that we can implement physical activity and the science behind it. If you find this channel helpful and informative, please click the subscribe button below and click the like button as well. How much physical activity do we need to do? So the US Physical Activity Guidelines indicates that we should do 150 minutes per week of moderate intensive aerobic exercise or 75 minutes of more vigorous exercise. Again, this is aerobic, which could be things like running or cycling or swimming, things like that. Now, in addition to the aerobic exercise, we also should do 2 days a week of strength exercises, which could be things like push-ups or weightlifting, things like that, okay? So again, aerobic exercise and strength exercise, both of these things we need to implement on a weekly basis. Aerobic exercise, or some people call it cardio exercise, at a moderate intensity, think about that as just sort of like a medium or moderate amount of effort that you're putting into it, right? It gets the heart rate up a little bit. So what are some examples of moderate intensive activity, right? So it could be walking, but that would be sort of at a brisk pace of about 2.5 miles per hour. And you can use a smartwatch or your smartphone, usually can give you that information. It could be dancing, it could be gardening, it could be biking at about 10 miles per hour. These are all typical things that would be at a moderate intensity, but again, it may be different for each individual. So what might this look like in a real life example? So let's say you commute to work every day. So what if we can add, let's say, a 15-minute brisk walk in the morning when you go to work and 15 minutes on the way home, right? So that's 30 minutes a day right there. And if you do that Monday through Friday, that's 5 days, that's going to give you the 150 minutes right there. So not too difficult to reach it. And, you know, in practicality, maybe if, let's say, you're driving to work, maybe you park at the far end of the lot to give yourself 15 minutes to walk. Or if, let's say, you live in the city and you're taking the subway or a train to get to work, maybe you get off one stop earlier and then walk that little bit and get yourself that 15 minutes and do the same thing on the way home. So this is an easy way to implement some physical activity that will reach the guidelines, help get us all those health benefits, and not take too much extra time out of our day. And changing our thinking about physical activity and exercise, we're really talking about physical activity here, which is the important thing. And so many things that we may not even think about are physical activity, like walking your dog or gardening, things like that. Okay, we need to think about as physical activity and implement that because that will help get some of these health benefits. So now let's turn up the dial. We were talking about moderate physical activity. Now we're going to talk about vigorous activity. So as you can imagine, the amount of effort that you're going to put in is just going to be more than moderate. and it has to be pretty significant. So you're really sweating, maybe a little bit short of breath because you're really working hard. And here, you're not going to be able to hold a conversation with your friend while you're at vigorous activity. Maybe you get a few words in, but that's it. So that is vigorous activity. So what are some examples of vigorous physical activity? Sure, it could be running, it could be swimming, it could be playing singles tennis, it could be cycling at more than 14 miles per hour. So you get the idea. There are many different ways for aerobic exercise that we can get that really turns up the notch and makes it vigorous. So how do we do this? How do we mix and match vigorous and moderate activity in our daily life to make these numbers work for us to reach these goals of the physical activity guidelines? And so here might be one example. Maybe on the weekend, you take a 30-minute bike ride at a vigorous pace, okay? So there's 30 minutes of vigorous activity. Then let's say during the week when you go to work, or if you're coming home and you live in an apartment, you have to go upstairs. So if you say climb stairs and you do that for 5 minutes, okay, just a 5-minute stair climb, and you do that 3 days a week, that's another 15 minutes. So now we've had 30 minutes of vigorous activity with biking, another 15 minutes of vigorous stair climbing, so we're already up to 45 minutes of vigorous activity, right? And so the formulation is that vigorous activity, okay, is almost the same as doing twice as much moderate activity. So 45 minutes of vigorous activity is the same thing as like you just did 90 minutes of moderate activity. Great, so we're already up to that almost 90 minutes. And now let's say we add some walking, okay, to the grocery store, something like that. Maybe we add 20 minutes of walking to the grocery store or errands around, and we do that 3 times a week. That's another 60 minutes. Boom, we're already there at our 150 minutes equivalent, okay, of moderate activity. So again, you can mix and match vigorous and moderate. And the way that you could do the quick math is that any vigorous activity you do, it's like double the moderate. So 10 minutes of vigorous activity is almost the same as doing 20 minutes of moderate activity. So you can just figure out ways in your week to sort of mix and match and get to that equivalent of 150 minutes a week of moderate activity or 75 of vigorous activity. So again, mix and match, just find ways that you can easily implement it into your life. It's going to make a huge health benefit for you. A quick self-check-in while you're exercising, particularly if you're just getting started, to know are you at moderate intensity or vigorous intensity, is the talk test. So again, as we already mentioned, so if let's say you're doing exercise and you're working hard, but you're still able to easily have a conversation, that's moderate. If you're working hard and you're sweating, but now it's really difficult to hold a conversation, maybe you can only get out a couple of words, okay, now you're at a vigorous intensity. So this talk test just makes it easy for people to get a sense of how intense their physical activity is. So let's go over some tips for getting started with exercise, because we know that it can be very hard to create new habits. So I think the first thing that we have to think about is some people say to themselves, I'm just not an exerciser. And so we need to change the lexicon, how we think about it. It's not, say, exercise, but it's physical activity. And I think pretty much everybody can imagine themselves as wanting to just be more active. So that's a different way to frame it. And I think that can be very helpful for people to start being active as opposed to say, hey, I'm going to start exercising. So the key here when you're first starting is start slow. Take it easy. You want to take things in a slow pace. Maybe you're first going to just take some nice, easy walks outside. Just get used to doing some physical activity. So walking is a great idea, right? It's free. It doesn't take up too much of your time. You can use it while you're already doing other errands and things like that. So that's a key component to getting started. Make it easy. Exercise or physical activity is not an all or nothing proposition. Okay, and this is where I think some people get tripped up. They're like, oh, there's no way I can do 150 minutes a week, so I'm not even going to start. So we want to avoid that. And the key here is that even doing a little bit is going to make a big difference. So particularly for people who are completely physically inactive, doing some physical activity, even if it's less than the physical activity guidelines, will have a tremendous improvement on their health. So just little increments of going from 0 to something will make a big difference on your health. So just get started. Just start implementing it. Don't worry right off the bat, am I reaching the 150 minutes? Sometimes that goal might seem too daunting and too much. Don't worry about it. Just start doing some. The next tip is taking out a chunk of time to be able to do this. And this is another one where I think people get tripped up and they say to themselves, oh my, there is no way I can dedicate this much time to exercise and physical activity. Is the idea that something is always better than nothing. And there are studies that show that even just taking small chunks of time, 5 minutes, 10 minutes, that's all you need to do. So if you could take just a simple 10-minute walk, that is going to already start implementing some health benefits. So you don't have to immediately say, oh, I don't have 45 minutes to dedicate today to exercise. Don't worry about it. Do 10 minutes, implement 10 minutes of walking on that day, and that's already a start. Final tip, don't get sucked into the body image trap. Avoid the pitfall of associating physical activity and exercise with losing weight or looking a certain way. Again, our primary focus and mission here is to use physical activity and exercise to make us healthier. And these health benefits start almost immediately. Body image and weight loss are very difficult to achieve. And many people, if they go in to physical activity and exercise with that goal set, very often will become discouraged because it is very hard to achieve that. So let's refocus our goal to align with our mission that exercise is a powerful tool to improve our health. Is it safe for me to start exercising? And the answer, based on many of the studies, is a resounding yes. It reduces the risk of death, reduces the risk of cardiovascular disease. So there are many studies that promote and show that being physically active is safe and healthy. If you have never been physically active before, you can't start at vigorous intensity. It's not safe for you to just go from doing nothing to running a marathon or shoveling, 3 feet of snow if you're not someone who's normally physically active. The idea is to start easy and then slowly increase your activity. Now, if you are someone that has some sort of medical condition, then of course you should speak to your physician prior to starting. And sometimes when people first start exercising, they'll notice, oh, my muscles are sore, and they're worried, is that a bad thing? Am I injured? So no, having sore muscles is actually a good thing. Some people like the feeling. I like the feeling because it lets me know that my muscles are working and that I'm gaining the benefit. It's just part of the process of your muscles recovering from doing the exercise. And this is letting you know that, hey, your exercise is working, your muscles are getting stronger. So having some muscle soreness is completely normal and expected, and it's fine. Now, obviously, if you're having significant pain, that would be a different issue. So now that we've sort of wrapped up the aerobic exercise portion of our physical activity guidelines, there's also the strength side. And so again, the recommendation is that we do strength exercises twice a week, hitting most of our major muscle groups. Okay, now, similar to aerobic exercise, strength exercises, it improves our health, improves our quality of life, and has many health benefits. And so some of these health benefits also include our physical function, particularly for older people. So you can imagine that as someone gets older, needing to, let's say, lift the groceries or climb up a flight of stairs to get to their apartment, they require some amount of strength. And staying physically strong by implementing strength exercises is going to be a key component to having high quality of life. Strength exercises can be a bit more complicated for people to get started. Primarily, there might be a lack of knowledge. What exercises to do? How do you do them? How often do you need to do them? How much weight? So some of these concerns can act as a barrier for some people to initiate and get started with strength training. You can start with no equipment. You can start at home. Start trying to do things like push-ups or sit-ups or air squats. So there are exercises that can start being done with no specific equipment. Once you do that, you could go up a little bit and have some minimal equipment. Use things around the house. Hold a carton of milk while you're doing your squats or something like that. Or maybe you use some cans as some light weights. or you can maybe buy some resistant bands. So there are some minimal exercise equipment that you can buy to help you achieve that. As people get started, they may quickly see that their strength is increasing, and then some of these minimal exercise equipment might not be enough for them to continue to progress. So that can be an issue sometimes, but again, something is always better than nothing. Now, alternatively, as maybe you get into it and you start seeing that your strength is increasing and not having some exercise equipment makes it that it's not challenging, you could buy some real equipment for your home. For some people, that could be like dumbbells or pull-up bar or some other gym equipment, and there are many things online and resources online, but that could be something that people can implement to try to start increasing their resistance to get stronger and stronger. Another alternative is to join a local gym or a local Y, and here the advantages are many. One, they have all the equipment, and two, they will have fitness professionals there who can help educate you, motivate you, help take you from not doing anything to doing something. In that initial phase of being sort of physically inactive and then starting to learn how to do strength exercises. So you do that for a short period of time, and then you have that knowledge, and then it becomes much easier for you to do it on your own. So if you have the opportunity to join a gym or a local Y and work with a fitness professional, I think that is an ideal solution. So some simple sort of concepts about doing strength training or resistance training. And the idea here is that it should be progressive, which means that as you start, your strength is going to get more. So you're going to need to keep challenging yourself so that you continue to build strength. I think a very simple framework, okay, for someone who's starting is to say to themselves that whatever exercise it is, let's say doing push-ups, you want to be able to do at least 8 to 10, okay? Or let's say you're doing some dumbbells for chest press, right? So let's say, again, you want to be able to do somewhere between 8 and 12 repetitions. So the way to think about this is that, let's say you're using 10-pound weights and you find that, oh, I can do 20. Okay, so that means that that weight is too light for you, and so you should increase the weight. So maybe you go to 15-pound weights, okay? And then maybe you find, oh, I can only do 10. Excellent. So now we're kind of in the right framework to help you say, hey, I'm using the right amount of weight. Now, over the next few weeks, you might find, oh, now that I've been training, I can easily do 15 repetitions instead of the 10. Okay, so now is an indication that maybe we need to increase your weight from, let's say, the 15 pounds up to maybe 20 pounds. So this is the idea. This is what we mean by progress. So as you keep exercising and you keep getting stronger, okay, it's going to be easier if you stay at the same weight. So we want to keep challenging ourselves. And using this simple framework of that you should be able to do somewhere between 8 and 10 reps is a very simple, easy metric that people can use to help guide them as they're increasing and progressing their strength training. Now, the converse is true too. If, let's say, you picked a weight and it was so heavy that you can only get up 1 or 2 repetitions, that's an indication that right now that weight is too heavy and you're going to want to lower the weight. And again, the idea is pick a weight that you can get at least 8 to 10 reps in. And finally, remember that the idea is to try to include all the major muscle groups, okay? You want to include your arms, your legs, your chest, your back. You want to try to do exercises that help include all of these. What if somebody has some orthopedic problem? And being an orthopedic surgeon, we see this a lot, that there are some people who have some musculoskeletal problems that make it difficult for them to maybe do some of these exercises. So if that's the case, then a great resource is working with a physical therapist. And a physical therapist can help address some of these musculoskeletal issues to help you and those patients to become physically active, because that is our primary goal, is be physically active and to be able to function to do the things we want to do in our daily lives. So there you have it. Let's sum everything up. For our physical activity guidelines to help get the health benefits that we've listed in the beginning, reaching 150 minutes a week of moderate intensity exercise or vigorous intensity exercise, or some mix match to get us to that same number, is what we want to achieve from our aerobic exercise And we want to be able to do twice a week strength training. So this is the framework that we want to try to meet. And again, remember, you don't have to reach that right away. If you're first starting out, start slow. Something is always better than nothing. And hopefully over time, as you make being physically active part of your life, you will increase that amount and reach that goal. And remember, more is always better, but we got to get there slowly. You could click on a link somewhere on this page. It will take you to a free copy of the physical activity guidelines with some nice infographics. So I think that could be a great resource, particularly if you're just getting started. Please subscribe to our channel and click the like button below. Thanks for watching this video. I'll see you in the next video or maybe in my office. Have a great day.